The Federal Trade Commission says a monopoly has cost Texans tens of millions of dollars more each and every year for anesthesia services when undergoing medical procedures, and that includes right here in Houston.
That's right. Well, the FTC sued a private equity firm and U.S. anesthesia partners earlier today, accusing them of driving up prices. Consumer Reporter Heather Sullivan joining us live in studio with more details. Heather.
Yeah, so you're having to have a medical procedure. You need anesthesia. The FTC says Texas patients and insurance companies have been forced to pay millions more for the services since they say a monopoly started forming over the last 10 years.
As you know, anesthesiology services are quite critical. If you're in a hospital and you're getting a critical procedure, you want anesthesia.
The Federal Trade Commission has sued U.S. anesthesia partners and private equity firm Welsh, Carson, Anderson, and Stowe.
And what this firm decided to do was pursue a roll-up scheme where they bought up a whole set of anesthesiology practices across Texas, in Houston, Dallas, San Antonio, Austin, Amarillo, and ultimately use that consolidated power to jack up prices.
The suit says USAP became a monopoly in Texas and also had illegal price-setting agreements with remaining independent practices and struck a deal to keep a competitor out of USAP territory.
We'd like the court to find liability and ultimately provide relief. And that relief would entail restoring competition to all of these Texas markets. And ultimately, that competition could mean lower prices and better service for Texans.
USAP sent us a statement from board member Dr. Derek Schappa reading, quote, "The FTC's intended outcome threatens to disrupt and restrict patients' equitable access to quality anesthesia care in Texas and will negatively impact the Texas hospitals and health systems that provide care in underserved communities. The FTC's civil complaint is based on flawed legal theories and a lack of medical understanding about anesthesia, our patient-oriented business model, and our level of care for patients in Texas." And this comes after the Journal of the American Medical Association has reported that private equity firms have been buying up physician practices across the country in anesthesia, emergency medicine, and dermatology. JAMA reported that patient costs went up 26% after private equity firms took over anesthesia practices. And we'll keep you posted on this case. Heather Sullivan, Fox 26 News.